Hello guys, welcome back to Bioethical Prescriptions. Today we are going to look at a very important subject in biomedical ethics. Healthcare professionals, doctors and nurses need to make ethical decisions at the point of care. And this decision making must adhere to four major principles. Principle number one, autonomy. Then we have beneficence, principle of non-maleficence, and justice. We are going to look at these four principles today so that when you go to the hospital, you know what your healthcare provider is supposed to do, what is right for them to do, and what is not right for them to do. And also, you can know what your right is as someone who is seeking care. Now, let's take the first principle, the principle of autonomy. The principle of autonomy simply guides healthcare professionals to respect the decision making and the concerns of their patients. So simply the principle of autonomy, with the principle of autonomy, every healthcare worker is supposed to respect the decision about the care of every patient. So there are two major criteria for this particular principle. That number one, the care provider must give you all the information you need about the care in order for you to make the decision if you want that care or not. Number two, you, the patient, need to have the capacity to make an informed decision. So, let's say for psychiatric patients, they don't have the capacity to make right decisions in some sense. So, in this case, their autonomy may come into question. Let's also take minorities or children who are not able to make decisions on their own. So also over there, their autonomy is going to be questioned. But apart from that, every other patient who is seeking care, their care provider must respect their decision about their own care. Let's take an example about autonomy. So imagine you're a patient and you go to the hospital and your physician sees that surgery will be the best treatment for your condition, but you do not think so. So you would like to explore medical options. You would like to take medications first before you will consider surgery later. In this situation, even though the physician thinks surgery is the best option for you, the physician must respect your autonomy because that is what you want, provided the physician gave you all the information about the surgery, the benefits and the risk of the surgery, as well as the benefits of the medications which are available. So in this case, if you have all the information and you have full capacity to make a decision, then your decision stands. Let's take another example. Let's imagine a patient is diagnosed with cancer and the treating physician proposes chemotherapy, but the patient does not want to go through chemotherapy. Their autonomy must be respected, provided they have all the information about the treatment options. Or again, let's imagine a patient who needs blood transfusion. So the doctor says you need blood transfusion, but for religious reasons, the patient does not want to get a blood transfusion. Their autonomy should be respected, provided they are advised as to why they would not prefer blood transfusion. If everything is understood for them and they have the capacity to make a decision, then their decision not to accept blood transfusion should be accepted. In summary, doctors and nurses must respect your choices as long as they have presented to you all the information about the choices you have, and as long as you have the capacity to make an informed decision. Now let's look at the second principle, the principle of beneficence. The principle of beneficence guides physicians and expects physicians and other healthcare workers to always make decisions that are beneficial to the patient. So in this case, the healthcare professionals must act in ways that always benefit the patient. Now we are going to look at some examples. Imagine a physician prescribes a medication for heart attack. Currently, you do not have heart attack, but they are prescribing a medication for you which will prevent you from having a heart attack in the future. Even though you do not have heart attack now, they are acting for your own good. So they are acting in a way that benefits you in the future. So in this particular case, you do not have heart attack, but they are already acting for you not to have heart attack in the future. Let's take another example. Imagine a surgeon proposing surgery to remove tumor before the tumor grows bigger, which will be problematic later. Even though the tumor is not big now, the surgeon is proposing it being removed now. This is also another example of beneficence because the surgeon is advising in your own favor. Now let's look at a third example. A nurse caring for patients, giving them medications or painkillers just to manage their pain and suffering is also another example of the principle of beneficence because the nurse is acting in the benefit of the patient. So in summary, the principle of beneficence expects healthcare workers to always act in ways that are beneficial, or they must act in the interest of the patients. So they must give care that is very beneficial for the patients. So in that case, in beneficence, healthcare professionals must always work to keep you healthy. Now, the third principle is non-maleficence. Non-maleficence means doing no harm to patients. So in the second principle, we spoke about doing good to the patient. The third principle expects professionals not to do harm to their patients. So sometimes this means that the professionals are going to balance the risk and the benefits of their care. Think about this before they give their care. We can again here look at some examples. A doctor might have an option to prescribe a certain medication, but then he realizes that the risks or the side effects of that medication actually outweigh the benefit that the patient will get from the medication. The doctor can decide not to prescribe. In this case, they are trying to prevent the side effects which are higher than the benefits. So this is an example of a doctor having a duty of non-maleficence because they do not want to do you harm by giving you that medication. Let's take another example. A doctor may see that a surgical procedure is the best procedure for a certain condition, but in weighing the harm and the benefits, they can see that the surgery may cause other complications which are not good for the patient. In that case, they may avoid doing the surgery in order to protect the patient. Now, this is also another example of non-maleficence at play. It means the doctor does not do you harm, and so they are going to avoid doing the surgery. Finally, we have the principle of justice. The principle of justice deals with fairness, and so it concerns the distribution of healthcare services. Healthcare professionals need to distribute care fairly to everyone, irrespective of their status or who they are. We can take a few examples. In organ transplantation, organs are distributed according to the needs of patients, not according to the status, the wealth, or who certain people are. Rather, they are going to be distributed according to who needs them. To wrap it up, today we discussed the 4 principles of biomedical ethics. The principles are autonomy, beneficence, non-maleficence, and the principle of justice. I hope you have taken note of these principles, and the next time you go to the hospital, you can tell when your healthcare professional is acting ethically or not. Don't forget to like this video, subscribe, and share, and see you in the next video. Bye bye.